What is WPath?
Great to talk about this with you. This is a really sensitive subject, and I admit to being a little nervous about it and about the whole topic of trans and genders. Putting all that aside, you might be a very liberal and tolerant person, consider myself that, and have always been very supportive of gay rights, gay, lesbian, bisexual rights, trans rights. But when you get into really what's going on, we're looking at a case of very serious medical mistreatment where children and vulnerable adults are being given drugs and being given surgeries without them understanding the implications of those drugs and surgeries. Since we did the Twitter files, we've had a number of people come to us as whistleblowers with pretty big stories. And somebody came to us last year, somebody or some people, source or sources came and they brought a set of files from an organization that I had never heard of. It's called the World Professional Association for Transgender Health, otherwise known as WPath. It's had a huge influence. And so the American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, all are heavily influenced by this organization. And this is an organization that argues that children, including at very young ages, as young as 10 years old, should be affirmed in their gender dysphoria and prescribed puberty blockers, cross-sex hormones, and have surgeries. And the files that came to us were both text, mostly text, but also video. And they show conversations among surgeons, nurses, therapists, and activists over how to deal with many of the problems that have emerged in so-called gender medicine. The report that we've done, it has a subtitle. So the title is the WPath files, and the subtitle will tell you a bit about what's in the files. The subtitle is Pseudoscientific Surgical and Hormonal Experiments on Children, Adolescents, and Vulnerable Adults. This is obviously an extremely serious accusation that we're making in this report. We have heard from WPath. There has been some intimations, one might even say threats of a lawsuit against us for publishing the files. We are well within our constitutional rights to publish these files. We believe that making these files available in their entirety as they were given to me is in the public interest. And so we are releasing these files as well as this introductory report. It's a over 70-page report that goes through, explains what's being said in the files, and also puts them into context with some references to peer-reviewed scientific literature and some other information that's come out about what's called gender medicine. This so-called gender medicine goes back almost 100 years. I think it's quite notable. The first, male to female transition was done by a doctor who then went to work for the Nazis in Dachau, performing hypothermia experiments. You fast forward through a bunch of experimentation to the 1950s. There's a famous German endocrinologist named Harry Benjamin who sort of pioneered this gender medicine. And then an organization that was called the Harry Benjamin International Gender Dysphoria Association was started in 1978. That organization rebranded itself WPath in 2007.
What was their objective?
Well, the original objective was to better treat people with what was called originally gender identity disorder. It was a psychiatric disorder recognized by the American Psychiatric Association in the DSM, which is the handbook for
Yeah.
The trans activists lobbied very hard to change the name of that disorder to gender dysphoria. And in that shift, you can see that it becomes political, it's becoming ideological. The idea is that it's not actually a psychiatric disorder, that really what they're saying in that name change is not that there's a disorder, but just that there's some confusion related by being born into the wrong body. So right away, you can see what I think, and I think a lot of other people that work on this think is a fundamentally pseudoscientific idea, which is that there's more than two sexes and that you can change your sex. I think it's fundamental biology that there's two sexes. It's a sperm and an egg that combine. That's how you can create human beings. There's two sex hormones, testosterone and estrogen, and there's not a third sex. The idea around not being gender conforming, well, that's I mean, what does that even mean? I mean, my idea of what it means to be a man is very different from my grandfather's and very different from what it was 1,000 years ago or 2,000 years ago. So, but the idea is basically that if you you as a man or a woman or a girl or a boy have non-stereotypical behaviors, that somehow that means that you might actually be the opposite sex. That's not a scientific view. That's a deeply pseudoscientific view, in my view and the views of many others. And what's more, the files themselves, and I think if there's one thing you want to take away from this, what it shows is that the professionals involved in so-called gender medicine recognize that both the children and the parents, as well as the people with mental illness that they're so-called treating, they know that they don't understand what they're getting into. We have one famous quote one quote should be famous from one of the surgeons who says that we're trying to help kids to understand what's going to happen to their bodies before they have high school biology. You're having kids making permanent decisions, including sterilization, but also losing the ability to have orgasm. Kids are often making these decisions before they've gone through puberty. That's what the puberty blockers are for. What we're dealing with here is, in my view, one of the worst medical mistreatment scandals in human history, and maybe the worst. I mean, at the end of the report, we compare it to lobotomies, ovarectomies, where the ovaries are removed. These are past medical scandals. We prohibited lobotomies when people finally understood what was going on. But this, in our view, is a case of serious medical mistreatment, completely separate from how you feel about men that cross-dress or that want to present as women or women that want to present as men. I think a lot of us, myself included, are perfectly fine with that. And we're perfectly fine with people defining what it means to be a man or woman in their own way. What we're talking about here is a case of medical mistreatment for children, adolescents, and vulnerable.